system. Can you recall the anatomy of genitourinary system? Anyone? What are the parts of urinary system? What are the parts of urinary system?
Kidneys,
Kidney,
ureters,
ureter,
urinary bladder, urethra.
urinary bladder, urethra. What are the technical names? What is the technical name for kidney?
Nephro.
Another term?
Renal.
Renal. Bladder?
Cysto.
Renal pelvis is a part of
Kidney.
Kidney. What is the technical name for renal pelvis?
Philo.
Okay. Next, come to male genital system. What are the parts of male genital system?
Testis, penis,
epididymis,
glans,
vas deferens, seminal vesicle, prostate. Now, what is the name for testis? Testis.
archeo.
Okay. Now come to female genital system. What are the parts of female genital system?
Fallopian tubes,
Fallopian tubes, ovary, uterus, cervix, vagina, vulva. These are the parts of female genital system. What is the technical name for fallopian tube?
Salpingio.
Fallopian tube. Ovaries,
Oofro.
uterus,
Metro.
hysterocum, metro.
Metro.
Vagina, Calpo. Vulva, Epsio. Vulva, Epsio. These are the technical names of male, female, and urinary system. Now, make heading. First, we are going to discuss female genital system. Female genital system. Go everyone in your CPT books, female genital system. Female genital system. Everyone, are you there? Go with the index. Female genital system. Are you there, everyone?
Yes, sir.
Okay. Now you can see the diagrammatic representation, and you can see here, incision means, as you know, the people technical name for incision. Incision
Yes,
means
sir.
otomy.
Otomy.
Sometimes artificial hole creations, ostomy. Those two are parallel terms you will get under incision, otomy or ostomy. Now, destruction means, just if you want write down anywhere, fulguration or ablation. What are the synonyms for destruction? Fulguration or ablation. Fulguration or ablation. Excision means, as we know, what is the technical name for excision? What is the technical name for excision?
Ectomy.
Ectomy. Ectomy. Repair means
Graphic.
Plasty.
plasty.
Plastic.
Endoscopy means visual examination. Incision, destruction, excision, introduction, repair. Manipulation means reduction. Manipulation means reduction. Manipulation means reduction. Laparoscopy, as you know, visual examination of abdomen, through that they can perform the procedure. These are the procedures. Now you can tell me, see, what are the common procedures a physician can perform on female genital parts? What are the common procedures a physician can perform on a female genital part? One is incision, repair, endoscopy in some body parts, laparoscopy in some body parts, manipulation, introduction. Yes or no? These are the common procedures a physician can perform.
Yes, sir.
Now, first make heading maternity care and delivery in female genital system. Make heading maternity care and delivery. Maternity care and delivery. Maternity care and delivery. Go with the codes maternity care and delivery. It is in page number 440 for you. Are you there, everyone?
Yes, sir.
Okay. Yeah. First question, right? That means first rule. Twins delivered by vaginal. Twins delivered by vaginal. Twins delivered by vaginal. Twins delivered by vaginal. Use 59400, 59400, 59409 51 modifier. 59400, 59409 51 modifier. Next. Twins delivered by C-section. Twins delivered by C-section. Use 59510. Twins delivered by C-section. Use 59510. Next point. Twin A vaginal. Twin A vaginal. Twin B C-section. Twin A vaginal. Twin B C-section. Twin A vaginal. Twin B C-section. Use 59510, 59510, 59409, 59510, 59409, 51 modifier. 51 modifier. Everyone read these codes. I will explain. Try to read the codes in your CPT book. Everyone read the code 59400. What is the code description? That means physician is providing antepartum care. Antepartum care means what? Before the delivery, and the physician only performing vaginal delivery, and the physician is only performing postpartum care. That means one physician is involved in total care of a pregnant woman. That means antepartum care, delivery, and postpartum care. Yes or no? In 59400.
Yes, sir.
59409. 59409. What is the physician is performing? Only delivery, vaginal delivery. You can look into the code only delivery. 59409. The physician is performing only vaginal delivery. Yes or no? In 59410, the physician is performing delivery along with postpartum care. One physician is performing delivery with postpartum care. This is one type of scenario. Another type of scenario, as we know, there are two types of deliveries. One is vaginal, another one is cesarean. 59510, 59510, antepartum care. But what is the type of delivery in 59510? Cesarean delivery. What is the delivery? Cesarean delivery and postpartum care. 59514, only cesarean delivery. 59515, cesarean delivery with postpartum care. These are the codes. Understood? Up to here clear? Now listen, what I said the rules, these you can code easily based on the documentation. What I said, twins, two babies delivered delivered, then how you will code. If they delivered vaginally, first code is 59400. First baby. Second baby is 59409. Two babies delivered by C-section. Only one code 59510. One baby vaginal, one baby C-section. At that time 59510, 59409. Understood everyone the rules here? Now tell me, from fetus to mother, which is the connecting part? Fetus to
Umbilical cord.
Umbilical cord.
umbilical cord, then placenta.
Yes, sir.
Okay. Now, generally, the baby will come outside or placenta will come outside during the labor process.
Baby.
Now listen. See, sometimes what happens is the delivery of placenta is a part of surgical procedure. No need to quote delivery of placenta separately. Why? Because it is a part of delivery process, labor process. Now what happens is sometimes because of labor pains, before admission into the hospital, if a pregnant woman had delivered, okay, then after admitting her into the hospital, the placenta they are delivering. What is the work done by the physician in the hospital? Only placenta delivery. At that time, see the code 59414. 59414. 59414. Are you able to see the code 59414? Delivery of placenta. In bracket you can see separate procedure means no other procedure is performed along this one. This is the only alone procedure performed. That's why separate procedure. No other procedure is not performed along with this one. This is the only procedure performed. 59414. Now listen the scenario. A pregnant woman had delivered a baby 5 years back and again she is a pregnant. She is coming for delivery. Her desire is to go directly for C-section. She don't want vaginal delivery. Her desire is she wants only C-section. We call it as repeat C-section. What we call it as? Repeat C-section. Note down. Repeat C-section. Repeat C-section. Repeat C-section. Use 59514. Use only 59514. Repeat C-section. Use 59514 or 59510. These two codes, any one of the code can be used for repeat C-section. Repeat C-section. What are the two codes can be used here? 59510 and 59514. If only delivery, 59514. That in the repeat C-section process he performed antepartum care, delivery and postpartum care, then use the code 59510. Now check the codes. Did you understand all these codes? How to use? Check the codes. Any doubts? You can ask me. If no doubts, then make heading vaginal birth after cesarean delivery. Vaginal cases. Yes, please.
Sir, for vaginal delivery, you have to give two codes now, sir, for two babies.
Yes, two babies, Susmita. One after
For
another.
C-section, only one code, sir.
Only one code, Susmita. Why? Because
For twins.
the physician make a cut in the lower abdomen and they will pull all the babies outside. It's
Okay,
one-time work for the physician. It's a C-section.
Okay, sir.
Whereas vaginal delivery, one after another, not at a time two. Okay? That's why it's a two-time work for the physician.
Okay, sir.
Any other questions? Next. Yes. Yes, Geeta Kumar.
Sir, what is mean by B section, C section, vaginal delivery?
C-section vaginal delivery. Cesarean. Cesarean section.
Same
Normal delivery is vaginal delivery. C.
D section means, sir.
B section. B, there is no B section. Only two types of deliveries. One is C section, another one is vaginal delivery. Did I mention B section? No, C section. Where you
Okay,
got
sir.
this word D section?
Twin, a vaginal twin, BC section use 59510 and
Twin
59409, 51
C.
modifier.
Twin A is vaginal. Twin B means name. Name of the baby.
Twin A, twin B, okay.
Understood. See, twins I am telling as one name is A, another name is B. One
Okay,
baby delivered as vaginal, one baby delivered as C-section. Then how you will code like that?
okay, sir. Now understood.
Next, any questions? Yes, yeah. Next, make heading the concept. Reback. Vaginal birth after previous C-section. 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 What does it mean? See, listen the scenario here carefully. For example, she is a carrier for the second time. She is a pregnant for the second time. Her first delivery is happened through C-section. She is a pregnant for the second time. Her first pregnancy, how was the delivery? Cesarean section. Now this time the physician is trying for vaginal, and if the physician had done with vaginal, then the code is 59610. Now read the code description, everyone. 59610. 59610 in your textbooks. You would understand. 59610. 59610. Five nine six one zero. Understood, everyone? See, antepartum care is provided, delivery is provided. What is the type of delivery? Vaginal delivery. And postpartum care is provided when this was happened after previous cesarean delivery. That means what? Her first baby is delivered through C-section. This baby they have done with vaginal. Understood? Is that clear? Now read the code description 59618. Now they tried for vaginal, but again they performed C-section. They tried. They are not directly performing C-section. They tried for vaginal, but again they perform C-section. That is the meaning of 59618. Try to read the code description 59618. Is that clear, everyone? Now, make heading abortions. Abortion. Just write down the code series there. 596102 to 59620 is for VBAC. Now, my question is, listen the question and give me the code from 59610 to 59620, anyone. A pregnant woman is coming for delivery. This is her second pregnancy. Physician performed only cesarean delivery. Only cesarean delivery. Give me the code.
59620.
59620. 59620. Again, listen the question. A pregnant woman is coming for delivery. This is her second pregnancy. Physician performed cesarean delivery. When you read the code description,
59514.
59514 you need to give. See, directly they are performing C-section. They are not trying for vaginal. Where in this question I said they are trying for vaginal? If you read the code description 59620, what it is? Cesarean delivery only following attempted vaginal delivery after previous C-section. Where is this attempted vaginal delivery in this visit? Directly they are performing C-section. Understood? Try to see the question carefully. Now see, listen again one question. A pregnant woman with her second pregnancy. First pregnancy was C-section. This time they performed vaginal delivery. Now, how you will go?
59610.
First pregnancy is C-section. Second pregnancy. Now this pregnancy is vaginal birth. How you will go?
59610.
59610. 59610. 59610, everyone. You can see the code description. First delivery is cesarean. Now this delivery is vaginal. Like that you need to see and code. Okay. Yeah. Next, make heading abortions. Abortion. Now write down abortions. First one, incomplete abortion. Second one, missed abortion. Incomplete abortion. Second one, missed abortion. Third one, septic abortion. Septic abortion. Septic abortion. Next one, induced abortion. Induced abortion by three types. First one, DNC. DNC means dilation and curettage. Induced abortion by three types. First one, DNC. Second one, D&E. D&E, dilation and evacuation. Third one, by injections. See, when you are getting abortion related question, what are the four key terms we need to look for? One is incomplete, induced, septic, missed. These are the four key terms we need to look for. Then sometimes we can see trimesters. Try to recall the terminology of trimesters we have already discussed in pregnancy. 0 to less than 14 weeks, first trimester. 14 to less than 28 weeks, second trimester. 28 or more, third trimester. Now, read the code description 59812. Anyone in the class? 59812.
Treatment of incomplete abortion
Incomplete
in
abortion.
any
Trimester.
trimester.
59820.
Treatment of missed abortion completed surgically first trimester.
First trimester. 821. Second trimester.
Second trimester.
830. Septic abortion. 840. Dilation and curettage. 841. D&E. Dilation and evacuation. The rest of the codes are induced abortions with the help of injections. Take out your female paper. If the documentation is ovaries, you will consider it as bilateral or unilateral. Anyone in the class? If the documentation says ovaries, you may consider
Bilateral, sir.
always see the documentation properly. What is the verbiage? It's a singular one or plural one. Based on that, you can go ahead and then code like that. Okay. Question number 23, 23 and 26. 23 and 26. Rules, anatomy and terminology. Nothing is there. 23 and 26. Two questions. Make it fast. your answers if completed one by one. Question number 23 and 26. Try to do everyone. These are ABC papers. Like the same way you are getting questions in your final exam. At least practice 3 to 4 times individual papers. See, first question 23. 23-year-old woman presents with sudden LLQ left lower quadrant pain which does not resolve. The decision is made to perform exploratory laparoscopy revealing a cyst on the left ovary. See what they find cyst in the left ovary. The cyst is removed along with partial oophorectomy. Always keep in mind partial means they are not going to remove the total ovary. What is the CPT codes are reported for this procedure? 58661 everyone. 23B is the answer. 58661. Any other answers? 58661. Everyone. Any other answers? Any other answers?
No, sir.
Okay. Next one, question number 26. B is the answer. 59400, 5940951 modifier. Any other answers? Both are delivered through Brazil. 26 B for Bombay is the answer.
Okay.
B for Bombay is the answer. Any other answers?
Sir, I have a doubt, sir.
Yes.
If the physician does not mention whether it is vaginal or C-section, by default we need to code as vaginal only, sir.
Yes, of course, Kalpana.
Yeah.
By default is vaginal. If C-section is, they will definitely
Yes.
mention. Okay.
Yes.
Active labor means also it is vaginal.
Yes, yes, yes. See, the term C-section, cesarean means they will make an incision cutting transversely or vertically. Mostly they will perform low transverse. Transverse, horizontal, like they will clearly mention. No issues. Any questions? Okay, now do one more question. Try to understand the terminology and give me the answer. 32. 32. Who will explain me this question? Can anyone explain me this question? Priyanka. 32. 32. Geeta Kumar. 32.
A 56-year-old woman with biopsy-proven carcinoma of the vulva with metastasis to the lymph nodes has complete removal of the skin and deep subcutaneous tissues of the vulva in addition to removal of her inguinofemoral, iliac and pelvic lymph nodes bilaterally.
Okay, now listen up to here. See,
The diagnosis of
yes,
carcinoma.
Geeta. See, you need to understand the question when you are reading it, reading the scenario. See, first, they already identified because of biopsy there is a carcinoma in the vulva, which is a part of female genital part. From there, metastasis, it moved to lymph nodes. Now, can you tell me what is the primary and what is the secondary here?
Vulva is the primary, lymph
Vulva
nodes
is the
is the
primary,
secondary.
lymph node is the secondary. Now, what the physician decided they want to remove? What they want to remove? Vulva and in addition to lymph nodes also. Understood now? Is that clear, Geeta Kumari?
Yes, sir.
Now you can go and search the codes. That's it. Nothing is there. See, we need to simplify the question. We need to understand the question and you need to simplify the question, everyone. Text me your answers. Only 5. Maximum 8 people are responding to the questions. What about others? You are not doing? Yes, if you made any mistake, then I will correct your answer. Divya, can you read the code description 56637? Divya,
Yes, sir.
Divya, can you read the code description 56637?
Valvectomy with bilateral inguinofemoral lymphoidectomy, sir.
That's it, right? But if you see here,
Yes, sir.
in inguinofemoral, iliac, and pelvic lymph nodes they remove. Yes or no?
Yes, sir.
Okay. Now,
56640.
see the key term.
Okay, sir.
See, if you understand the match the following, the coding is one type of match the following. What is the procedure performed? That you need to underline in the question. That key term you need to match with your code description in the CPT book. Maximum times 90% like the same. 10% is little bit tricky that we need to understand the approach, we need to understand the technical names, everything. But 85 to 90% is nothing but match the following.
Yes, sir. 56640.
56640 with what is the modifier? 40 modifier. Understood?
50 modifiers, sir.
Yeah, sorry, 50
50
modifier.
mark, 50.
Yes, this is 50 modifier. Next, make heading male genital system. Male genital system. Male genital system. Go for male genital system. What is the page number? Male genital system index.
419, sir.
419.
Go for 417 everyone. Index list. Always first starts with index list. Try to see what are the topics present in that chapter. What are the possible procedures? You will get an idea so that it will be easy for you. Why? Because there are no rules here. Purely based on anatomy and terminology, only 5 to 6 codes. Those are the common procedures that we get on a regular basis. In US, what is the common procedure in male genital system is circumcision. Now you can see here penis. The technical name is PO. Incision, destruction, excision, introduction, repair, manipulation. These terms, you know the terminology. Testis means archeo. Again, here the terms, you know. Epididymis, tunica vaginalis, scrotum, vas deferens, spermatic cord, seminal vesicle, prostate. These are the names in the chapter. Body parts. Yes, sir, we can have a look. These are all we came across in anatomy. Now, first go with the quotes. And penis, the body parts: corpora cavernosa, corpora spongiosum, glans penis, and prepuce, the skin fold covering the penis. Now mark the codes. 54150, 54160, 161, 163, 54150, 160, 161, 163, 163. Write down at the code descriptions. 54150 the difference is age. In 160, if you read the code description, 0 to less than 28 days or 0 to 28 days. 54150 any age. 54150 any age, write down in your textbooks. 54160 code is particular regarding age, 0 to 28 days. Next difference between 150 and 160 is clamp. In 150 they will use clamp, whereas 160 other than clamp. See, when you are getting circumcision, what is the first point we need to look for? Circumcision. Age. Second point.
Age.
Second point.
Clamp.
Clamp. Always keep these 2 points. Third point, under 54150, can you see the rule that is important? 54150 with modifier 52 when performed without dorsal penile or ring block. You can see the code description 54150. If they want to perform circumcision by using clamp, they need to use dorsal or ring block. If they are not using those 2 techniques, any one of those, then what is the modifier we can use with the code? 52. If a follow-up or incomplete or anything, they are coming second time, you can see the code 54163. 54163. 54163. Repair incomplete circumcision. Now listen my question and give me the code. Patient age is 30 days. Circumcision is performed without clamp. Give me the code. Patient age is 30 days. Circumcision is performed without clamp. Give me the code.
54161, sir.
54161. Everyone?
61.
Okay. Now, the same question with clamp. Patient age is 30 days. Physician is used clamp to perform circumcision. What is the code?
54150.
54150. Understood? Next one. Listen the
50.
scenario. If a person is coming for follow-up of her circumcision in 30th day, what is the code? Follow-up for her
54163.
circumcision 30th day. What is the code?
54163.
54163.
160.
Incomplete. These are the 4 codes, very, very important. Next one. See, in males, to prevent further fertilization, that means a reproductive cycle, they will cut vas difference. Yes, sir. Male sterilization procedure is performed on vas difference. You can mark the code. Maybe it's a direct code. 55250. 55250. 55250. 55250. What is the code description? Vasectomy, unilateral or bilateral. Now, if they want to reverse it means, again, for example, if the couple wants further reproductive cycle, the physicians will do reversing technique. Then you can see the technique 55400. Vasotomy or vasorrhaphy. Both they are buying 2 ends. 55400. Next important codes regarding prostate gland. Go with the codes in your book. Double 5 8 7 4 8 7 5 8 7 6. 55 8 7 4 8 7 5 8 7 6. 8 7 4 8 7 5 8 7 6. 8 7 4 8 7 5 8 7 6. Now 8 7 6 8 7 5, you can see first the descriptions. In 8 7 5 they will place radio elements like uranium, thorium for treatment. Whereas in 8 7 6 they will place devices for treatment. Try to differentiate the two codes. 8 7 5 they will use radio elements for treatment. 8 7 6 they will place devices for treatment. 8 7 4 biodegradable agents other than radioactive elements. Understood the three code descriptions: 8 7 4 8 7 5 and 8 7 6. C5 said uranium element is placed for treatment. What is the code?
55875.
Try to recall the anatomy and terminology and give me the answer. Question number 29, 28, 29, 30. 28, 29, 30. Yes. See question number 28. Clamp circumcision is performed without dorsal on a newborn baby. C is the answer, everyone. 28. 28 C is the answer. Any other questions here?
Sir, here we are using 52 modifier, no?
Yes.
Sir, B is the answer, sir.
28
Actually,
C. C for Chennai. Why? Because here they are not using dorsal block. As per the rule, what is the modifier we need to use? 52.
But he is saying newborn baby, no, sir? Newborn baby
yes,
means
sir.
0 to 28 days, we will call it as newborn baby.
So if I again you are coming back.
150 any age.
54150 54160 age. 54160 other than clamp. 54150 using clamp. Yes or no, Shobha? Five four one five zero any age. Understood, Shobha? (28) C is the correct answer. Next, 29. Patient presents to the emergency room through complaints of an erection lasting longer than 2 hours. Solution is irrigated with corpora cavernosa. 54220. Any other answers? 54220.
Yeah, yes, sir. It is the direct answer.
54220. Okay. Next, question number 30. A fracture of corpus cavernosum penis is repaired. What is the correct CPT code? Plastic surgery on penis 54440. 54440.
Yes, sir.
Okay. These are
Yes, sir.
these are the answers for that question. Yes, Shobha. Still you are having doubt in that question, circumcision.
Yes, sir. I didn't get clarity, sir.
First point. What are the points I make you mark it that codes? What are the points I said just you can revise?
Using clamp other than clamp.
Clamp
Age.
the code.
Using clamp 54150.
Other than clamp, what is the code?
54160.
And 54161. Yes, sir.
Yes, sir.
54150. Is there any age documented in the code?
No, sir.
That means any age.
Yeah.
That's 54160. Age is documented in the code.
Yes, sir. 28 days or age or less.
When we need to use that code other than clamp. Yes, sir.
Yes, sir.
Now in the given question, they used clamp or other than clamp?
Without dorsal block.
They used clamp or other than clamp. In the given
Clamp, sir.
question, what they used?
A clamp. Okay, sir. They used clamp.
Clamp. That means 54160 is not an answer here.
Yes, sir.
Then
Thank
54150. Then they performed dorsal block in the question or without block they performed?
Without.
Without block. What is the rule says below the code description?
Report 54150 with modifier 52 when performed without dorsal penile or ring block.
That means what is your answer?
C.
See, now is that clear?
Yes, sir. Thank you.
See, like this we need to do male and female genital systems. Understood anyone today's session? Any questions? Any questions? This week we will complete your course for your batch by Sunday. Continuously you are having classes up to Sunday. Any questions? Tomorrow, before coming, just revise integumentary system. That means anatomy and terminology. Once I complete tomorrow urinary system, then we will start with integumentary system. That is the system which is having rules. Yes, yes, please. Any questions from your end?
Sir,
Yes, yes.
sir,
Yes, yes. Yes, Ashok.
sir, in digestive system, 50th question, can you explain, sir?
Digestive system. Question number
50, sir, 50th.
5.
Yes.
33-year-old patient's endoscopic suit to determine an ulcer. The physician performs a diagnostic scope through the esophagus, stomach, and into the duodenum and jejunum (EGD). During the scope, the patient. I need to share the screen. During the scope, the patient has a severe drop in blood pressure and the physician discontinues the procedure, but not before observing and diagnosing a bleeding ulcer in the stomach lining as well as perforated ulcer in the geogen. A repeat examination is planned. It's a 53 modifier here. Discontinued
Yes,
procedure.
sir. Sir, I got answer is yes, sir.
Okay. Yes.
So is this correct or not, sir?
Do you have rational?
It is C answer.
See, based on ICD, you can rule out A or C. Both are the same codes, right?
Yes, sir.
Yeah.
One is K25.4, another one is K28.5 or K28.1. That is, you can do based on ICD, you can rule out. You don't have the rational A. Ask the admin person, he will give you the rational A for this paper.
Okay, sir.
You coded correctly only. Yes, any other questions?
And 43, sir.
See, I said in the examination 45 questions, you can see the type of questions you are getting 10. Case studies, they are telling these are not case studies, just a detailed operative report. That's it. These are very easy compared to general. Okay. Question number 43.
43,
Oh,
sir.
this is one of the case study. You can see. See how
Yes.
I am doing this one to save my timing is, listen everyone. 43 question. Colectomy with a takedown of splenic flexure. Now, I don't read the question first to save my time. See, it's in real time. I need to read the operative report. I am already having the options here. You can see here. What I will do is, first I will read the option and then I will read the question. Then it is easy for me to rule out. Can you see here? 44139, 44140. Make it fast. What is the code description of 44140?
Colectomy partial with anastomosis.
Colectomy partial anastomosis. Anastomosis. That is 44140. 44139.
Yes, sir.
It's an add-on code.
Mobilization.
Mobilization of splenic flexure performed in conjunction with partial colectomy. Can we use this add-on code along with 44140? Yes. You can see parenthetical note is there. Then
Yes, sir. Use 44139 in conjunction with 44140, 44147.
44160 you can see colectomy partial with removal of terminal ileum with ileocolostomy. 44147 abdominal and transanal approach. 147 how I can read? Colectomy, partial, abdominal and transanal approach. Understood now? Now I will start reading the question. Now this is the way you need to do lengthy scenarios in the examination. Now I came to know colectomy partial with splenic flexure takedown. 44160 and 44147 is nothing but abdominal or transanal approach. Now I will start reading the question. Colectomy with a takedown of splenic flexure. Definitely 44139 have to code. 44139 is in the option B and D. Rule out A and C. Understood? Understood everyone? Now B
Yes, sir.
Yes, sir.
or D. Now you can see the approach. Trans-abdominal or transanal approach. Operating room, prepped and wrapped. A vertical paramedian incision umbilical from the incision was carried down to the rectus muscle. Nothing. There is no the malignant. There is no transanal or trans-abdominal approach. Yes or no here? Where is transanal, trans-abdominal approach? Nothing is here. Abdominal and transanal approach. Colectomy partial. Ethanostomosis. Malignant intra-abdominal placed and trapped. Vertical paramedium incision was made along the left side umbilicus from the 44147. 44147. 441. 44147. 44139. Yes. 43, right?
43.
Intra-abdominal cancer also showed. Did not indicate the origin of the cancer. Yes, 44147, 44139. Abdominal approach, right? Yes, yes.
In the last third line, they mentioned the anastomosis was manipulated with no extra vessation of air, is it, sir? So,
Without using any device, they have done that one.
okay.
But what is the approach in this scenario? Abdominal approach, they make an incision and they perform. And transanal, they are using any anal approach. Through the anus they are passing. Both the approaches they need to use. If they are not using both the approaches, then go by the answer. B is the answer. If they are using both the approaches to perform the procedure, use D is the answer. Now read the code description and then you can tell me. Understood now how to do? Is that clear?
Yes, sir.
See, two options easily I ruled out. Two options are with you. The difference is you need to see in the code description both abdominal and transanal. And means what? Both they need to use. They use those two approaches or not, you can check and then code. This is the lengthy questions, but we can do easily within less than 5 minutes. When you read the code description first and read the scenario. Understood everyone? First read the code description and then read the scenarios. Any other questions? Any questions?
Once explain 39 question. No? 39 question.
Sir, in that question, they use stamp TS stapler, sir.
So what? Stapler means suturing purpose. Staple means nowadays they use for suturing purpose.
They used for suturing purpose, and the attention was then directed towards the re-anastomosis of the colon.
See, re-anastomosis is not an issue. They have to bind the both ends together. The key term you are missing, Shobha. There are two codes in front of you. What I said, it is trans-abdominal and trans-anal approach, or just other than these two that you need to look for, not anastomosis. Understood what I am saying? See, there are four options in
Yes,
front of
sir.
you. Four options in front of you, Shobha. See, what are the points we need to look for? In those four options, two options easily ruled out because of splenic flexure. Then two options with you where the splenic flexure is there. One is 44147, 44140. What is the difference between those two options? One is they are using abdominal and anal, both the approaches. One is by default abdominal. Now you can read the code description of that question properly. Is there any trans-anal approach used? If they didn't use any trans-anal approach, then the answer is 44140. Like that, then what is the use of anastomosis here for you? Understood what I am saying?
Yes, sir. Yes, sir.
Always go based on the code description, the lengthy questions. Then only you can do less than 2 minutes. Otherwise, if you want to read this whole chart, then it will take for you 15 to 20 minutes. Waste of time.
Yes, sir.
What is the key term that you need to search in the question? That first read the code description and then read the question. You will do fastly. Yes, question number 39, right? A screening colonoscopy is performed.
Yes,
See
sir.
here what you have coded. Can you tell me? Option A, D.
Sir, I coded for
Yes, sir.
Medicare services, sir.
Yes, sir.
G0105.
In question number 39, where is G series, Shobha? We have to go according to the options. Where is G series here?
No, sir.
According to the screening, I coded for B, sir.
Actually, you are telling about ICD. You are telling about ICD. Okay, yeah, listen.
ICD, according to ICD, if it is coming to screening, we will code ICD for primary code Z12.11.
Sure, yeah, listen. Yeah, what is your CPT codes? Blindly rule out option A and D. Blindly rule out option A and D. Why? Because if you see in the code descriptions, polyps, tumors will be there. A and D ruled out. Then what are the remaining options with us? B and C.
B and C.
Then what is the reason for admission? Screening. And you can see polyps are also, you can say they are telling about benign or not. Two polyps in warrior.
Yes, sir.
Polyps snare. Portions of the polyp tissues were sent to pathology. And polyps they send. Then comes under what is the answer? B for Bombay is the answer.
B.
Bombay.
Any other questions that I need to discuss? Thank you everyone. Go through the anatomy of urinary system and integumentary system for tomorrow's session.